So we kind of talked about this already, that bioidentical hormones are really plant-derived, they're natural. Synthetic hormones like Premarin, Prempro, things of that nature, those are the synthetic hormones that are either synthetically made or they're derived from horse urine. Horse urine. So let's just swallow horse urine. Yeah. So for those of you that don't know me, here was the root of my whole evil in my 40s, was synthetic hormone replacement therapy. So I was somebody that went through menopause at a very young age, 41, 42, and I was on synthetic hormones for my entire 40s, and I really lost my entire 40s. I never felt well. I kept going in and saying, listen, I just don't feel like myself. There has to be something better for me. And I just kept getting synthetic estrogen, synthetic progesterone. Oh my gosh, I had a patch, I had a cream, I stuck it in my vagina, I swallowed oral. I did everything that you could imagine throughout my entire 40s. So the last time that I went in, I said, all right, this is really the real deal. There has to be something better for me. How about bioidentical hormones? I've been reading a lot about this, and maybe this would be a better option for me. And what did I get? Hands on the hip, the whole eye roll, and all estrogen causes breast cancer. In a couple years, you're going to have to come off all hormone replacement therapy anyway, or else you're increasing your risk of developing breast cancer. For me, and I was half crazy in the coconut already, that probably was not the correct thing to say to me. And especially, like I already alluded to, I'm the anal retentive internist, right? Striving to learn more. I was dedicated that I'm going to learn everything that there is to know about bioidentical hormones, because there has to be something better for me. So I trained with a world-renowned specialist in bioidentical hormones. And it was very, very interesting that I never said one word about anything about myself until maybe a few times that I was out to Houston training with him. And I finally felt comfortable. Oh my gosh, geez, Dr. So-and-so, a lot of these women, they sound just like me. And he was like, oh, are you menopausal? And at that time, I was 49 years old, and I said, yeah, I've been menopausal for 7, 8 years now. Oh, well, what have you taken? I started listing 15 things that I've done to replace my hormones, and he was like, listen, let's just draw your blood work while you're here. We'll be able to tell the whole story about what's going on with you. So, remember I was telling you, I was taking estrogen and progesterone, okay? I was swallowing estrogen every day. How shocked was I when I got my blood work back? I had no measurable estrogen at all, 0. It was undetectable. But I was swallowing the horse urine every day. And guess what else? We forget the other piece of the equation. I had no measurable testosterone whatsoever, 0. They couldn't find it in my blood. So what happened? He talked to me about doing bioidentical hormones. And so the very next time that I was out there and we started this whole journey on bioidentical hormones, I'm going to tell you, it was life-changing for me. At first I was pissed, because I said, you know what, I've been talking about this and crabbing about this for 7 or 8, 9 years. Why is it now that I'm turning 50 and I finally feel like I have my life back? So I got over that, but I dedicated now the last 8 or 9 years of my life to make sure that there is not one female that's either perimenopausal and they're transitioning into menopause, or a menopausal female that's going to suffer one day like I did throughout my whole 40s. That's where my passion is driven, because I was miserable. And how nice is it that this can be life-changing? And, by the way, it can be safe. And guess what? I don't have breast cancer. So anyway, so safe and effective, yes, estrogen, bioidentical hormones are safe and effective for reducing menopausal symptoms, degenerative diseases such as osteoporosis, cardiovascular disease, diabetes, cognitive impairment, which we'll talk a little bit about in a few minutes as well. So, when you rub bioidentical estrogen on your skin, or you use it in a transdermal form, where we put it into your subcutaneous fat, it does not affect the coagulation cascade. So remember we were talking about the horse pee? Well, guess what that does? It's metabolized through the liver, and it does affect the coagulation cascade. So it increases your risk for blood clots, legs, lungs, heart attacks, strokes. So think of this, young in my career, I've been doing this for a lot of years, but young in my career, we'd have somebody that, let's say they had like a coagulation disorder, they've already had a blood clot in their leg. And let's say they come to me and they're miserable with menopause. Well, really at that time, all I really knew about is, oh my gosh, you can't take synthetic oral estrogen. I'm gonna give you another blood clot. I'm so sorry, but you know, live with it, right? And how many providers still tell you that, by the way? Oh gosh, I'm so sorry you're miserable with menopause, but guess what? It'll get better. Just give it time, it'll get better. And what gets better with hormonal deficiency, right? So, anybody who has a strong family history of, let's say, heart disease, strokes, blood clots. Let's say you've had 7 miscarriages, but you've never been diagnosed with a coagulation disorder, which you probably have, by the way. You may not take synthetic hormones. Bioidentical hormones do not affect the coagulation cascade. I have done bioidentical hormones on a gazillion women who have already had blood clots, and guess what? None of them have any recurrent clots. The other nice thing is, there's no study that shows that we can't use bioidentical hormones indefinitely going forward. We'll go through those studies coming up as well. So, you know, here's the issue with oral estrogens and why you should never swallow estrogen orally, even if it's a bioidentical estrogen. Bioidentical estrogen must be rubbed on your skin or it must be put in your subcutaneous fat. Even bioidentical estrogen, you should never swallow orally. Here's what we get: breast tenderness, headaches, of course it raises your blood pressure, can cause nausea, vomiting, fluid retention. We already talked about the blood clots. Oh my gosh, how about gallstones? How about synthetic estrogen really messes with your thyroid function? How about women who have been on birth control pills for 25 years and you wonder why you have a thyroid disorder? How about that? Oral estrogen, right? And so also increasing C-reactive protein levels, so increasing overall systemic inflammation. So ladies, let's not put estrogen in our mouth ever, even if it's bioidentical. Progesterone. So this was another thing that came out with the Women's Health Initiative. Synthetic progesterone is a bad egg. That was the one that was really identified that maybe it had a potential for increasing your risk of developing breast cancer. So it has the same issues, the blood clot issues and all of that stuff as the synthetic estrogens. But what's nice about bioidentical progesterone, you may swallow that orally. So when we're doing bioidentical hormones in females, and let's say you still have your uterus, I cannot use estrogen in you unless we are also protecting that uterus with progesterone. If I'm not giving you progesterone, then what happens is that we're thickening that line, the lining of the uterus, and it's increasing your risk for a couple of things. Breakthrough bleeding. Who wants to have a period when you're menopausal? Like, been there, done that, we're done with this. But how about who doesn't want to develop endometrial cancer? So Bioidentical progesterone is something that we give every woman with a uterus that we're using estrogen to protect that uterus. Here's a known issue. You may never rub progesterone cream on your skin if you're using estrogen to give you protection of your uterus. You need full protection of that uterus. You've got to swallow bioidentical progesterone. So no rubbing of progesterone on your skin if you're using estrogen and you have a uterus.
So if you don't have a uterus, you don't need the progesterone?
That's not true. There are many women, so like me, my biggest issue, sleep disorder. If I didn't have a uterus, I can tell you without a doubt I would be swallowing bioidentical progesterone every single night. I don't need it for protection of my uterus, but guess what? It's the best sleep aid that you could imagine. So there are many women that I still use bioidentical progesterone even if we don't need it because you don't have a uterus. Sleep issues are terrible in menopausal women, and progesterone is very helpful for that. So, all right, here we go. Here's relief of symptoms when we're using bioidentical hormones. We've been able to prove that many of the things that we have with menopause, so hot flashes, night sweats, headaches, insomnia, palpitations, weight gain, painful intercourse, I don't care if I ever have sex with my partner ever again. I mean, these are all symptoms of menopause, right? We've already been able to identify bioidentical hormones will give you at least an 81.7% improvement in your menopausal symptoms from painful intercourse, dry vagina, no libido, headaches, weight gain, belly fat. By the way, bioidentical estrogen is a great belly fat burner. You know, all of those things can really get better with bioidentical hormones.